Good afternoon, ladies and gentlemen. Thank you all for finding time and visiting today's Facebook Live talk. My name is Tracy and I am dietitian at Assunta Hospital now. It's my pleasure to be the moderator of today's talk. In this special occasion, we would like to have a talk about heart attack in the young, fact or myth. Just a little housekeeping before we get started. If you have any questions during the talk, please type them into the comment box below. And your questions will be answered during Q&A session at the end of the talk. Besides, we would like to encourage you to share this Facebook Live talk with your social networks so that more and more people can join us. Before the talk begins, I would like to introduce the speaker today, Dr. Nicholas Chua. Dr. Nicholas is currently our consultant cardiologist at Assunta Hospital. He graduated from Manipal University with distinctions and gold medal award. Then he joined University Technology Mara UITM in 2013 as an interventional cardiology fellow and lecturer in internal medicine. In 2018, he pursued his advanced interventional cardiology fellowship in London. Dr. Nicholas has extensive experience in much of the procedures related to cardiovascular diseases, such as primary percutaneous coronary intervention. All right, without further ado, let us welcome the speaker today, Dr. Nicholas Chua, to deliver his talk.
Thank you, Tracy, for the kind introductions. Very good afternoon to all my friends and colleagues, ladies and gentlemen who are present today. I'm delighted to share this talk. I'm Dr. Nicholas Chua. I'm a cardiologist at Assunta Hospital. And the reason why I'm giving this talk is because I think most of us have noticed that the last few years, in the last decade or so, we noticed that more and more people are getting heart. That even celebrities also get heart attack at a young age. In fact, a few months ago, a celebrity from Indonesia, Jakarta, Ashraf Sinclair, actually had a heart attack at the age of 40. Before going further into today's talk, I'd like to share a real case of a 25-year-old gentleman who had a heart attack a couple of years ago. This gentleman had a single risk factor where he smoked 2 packets of cigarette a day. Otherwise, he did not have any traditional risk factors such as diabetes, high blood pressure, or high cholesterol. So he came to a government hospital with severe central chest pain. And one of the important investigations that was done was a 12-lead electrocardiogram. And with this information, we knew that he had a heart attack, meaning that one of his vessels of the heart was blocked completely. He was then referred to us where we performed his emergency angioplasty, and we call this primary side. One of his vessels, the one leading down in front of the heart, was completely blocked at 100%, and this is when we proceeded with an emergency angioplasty, where we passed down a little wire as thin as a hair, and this helps to recanalize to improve flow down the vessel. With this wire in place, we are able to perform certain maneuvers and procedures, such as putting in a little tube to help remove the blood clot, as we can see over here. So this was a microcatheter aspiration, and we can see that there were a lot of blood clots on the right-hand side in the little filter that we used. So after removing the blood clots, the flow improved, and we ballooned the vessel, and hence patient was ready for the stent deployment. This is a drug-coated, drug-eluting stent, and it's over a balloon. Once a balloon is inflated, the stent will be completely open, and this will help to keep the vessel open and improve flow. So over here we have the images showing the before and after, where at the beginning the vessel was 100% blocked, as we can see on the arrow on the left-hand side, and at the end of the procedure, blood flow has been restored, and there were no more residual blockage or stenosis. and this young man went home well. So I also like to share a bit about the heart. We know that the heart is an essential structure and it continuously pumps blood throughout the whole body. And the heart in turn also has its own blood supply. On the right side, we have one vessel providing blood to the heart. That is the right coronary artery. Meanwhile, there's another vessel on the left-hand side, a main vessel, which in turn divides into two main branches, one down in front of the heart. This is called the left anterior descending, and another branch to the back of the heart, and this is the circumflex artery. Let us now understand a bit more on the mechanism of heart attack with this video. How does a myocardial infarction occur? As we all know that high cholesterol causes narrowing of arteries. Other common risk factors will be high blood pressure, as we can appreciate in the yellow plug that forms this blood flow obstruction, and this is how a heart attack occurs. The other short video I'd like to share is a bit more on the angioplasty, which is a life-saving procedure during a heart attack. Angioplasty is a means to help to open up the vessel using balloons and also doing a narrowing of the arteries, where we pass through a little wire, and over the balloon we can see there's a drug-eluting stent over here that goes beyond and through each. And once located, the stent will then be completely deployed and open up. So this is how the stent helps to improve blood flow to a narrow artery. So how is Malaysia in terms of heart attack? How common is it, and where do we stand as a global perspective? Let us look at this global chart. We all know that heart attack is a leading cause of death in most of the countries, from Canada to the States, Brazil, Russia, even the Europe, UK, India, Australia, and also Malaysia. I would also like to share the top 5 causes of death in Malaysia. Heart disease is at number 1 at 22%, and this is followed by stroke, infections such as influenza and pneumonia, road traffic accidents, and also HIV. The other thing which is interesting to share would be the average age of heart attack. In a study that was performed a few years ago in Sungai Buloh, the mean age was very low at 55, and most of the patients were male, about 70% of them. If you were to compare to the national Malaysians, it was at 59. And let us look at our Western counterpart in the GRACE study, where most of the patients were from UK, Europe, and US. It's way higher at 66, about 10 years older than our patients in Sungai Buloh. What about our neighbor in Thailand? The mean age is about the same at 65. And what about the Gulf? Surprisingly, it was also very low at 56, similar to what we have here in Klang Valley. And in India, it was 16. So this trend is very alarming. Malaysians tend to get heart attack at a way younger age, similar to those in the Gulf. If you were to divide the patients in Malaysia by age, those below 40, and those in the middle age group, 40 to 70, and those above 70, we noticed that about 10% of them were below 40. Meanwhile, about 3/4 of them were between 40 and 70. If we were to zoom in into the young Malaysians with heart attack, let us look at their risk factors. The dominant risk factors would be cigarette smoking at 46%, and also those with high blood pressure at 43%. About a quarter of them already had prior heart attacks, and meanwhile the other common risk factors would be those with diabetes and also high cholesterol. So what are the common cardiac risk factors? This would be high sugar, diabetes mellitus, hypertension, those with high blood pressure, those with deranged cholesterol, those who smoke, and those who are obese, and those with a family history of heart disease will also be at risk of developing a heart attack. And also, finally, the important one also is poor dietary intake. As we all know, in Malaysia, we are actually spoiled with a variety of options in terms of our heritage. So this is also one of the contributing factors. The next thing I'd like to share in today's talk is the symptoms of heart attack. We can broadly classify this into into early symptoms and also an acute symptom during a full-blown heart attack. Early symptoms will be those who have a fixed narrow blockage in the arteries, and common symptoms will be an exertional chest pain or difficulty in breathing, known as shortness of breath. So many a times they may get chest pain or shortness of breath when walking up an incline or going up the stairs, and these symptoms usually disappear upon rest. These classical symptoms may indicate a fixed blockage in the arteries. Meanwhile, if you were to compare with the full-blown heart attack symptoms, this will be a severe central chest pain. Many a times it will go to the neck, the jaw, the left arm. Occasionally, it may go to the stomach, the opposite arm, and also to the back. The pain is classically described as a heaviness, and some of my patients do describe that the pain is as though you have a heavy vehicle, a car, or even an elephant is stepping on your chest. Apart from the chest pain during a severe heart attack, common other symptoms that may be present will be difficulty in breathing, the sensation of your heart beating very fast, palpitations, nausea, vomiting, cold sweats, and even numbness over the hand. So what can we do to detect this early? That's when cardiac screening comes in. Apart from a thorough clinical examination and history taking and routine blood investigations, common things that can be performed in the clinic will be an ECG. Here we have an example of a normal 12-lead electrocardiogram. So an ECG is a very simple, non-invasive test that can be performed to look for any abnormal heart rhythm or any abnormal electrical activity of the heart that may suggest any severe underlying heart disease. Another very common test that we usually perform is an ultrasound of the heart. We call this an echocardiography. An echo helps us to visualize the heart, to know its function, to look at the valves, to look for abnormality, if there's any leakage of valves or narrowing of the valves, and also to detect any abnormal motion. So over here, I have some example of a normal heart scan. This is an echocardiogram of a healthy heart. We can see and appreciate how the heart is beating, how forceful it is. We can also appreciate if any areas of the heart are not moving well, or is there any problem with the valves. Over here, we also have an echo of a different view. We can appreciate all four chambers of the heart, and many a times we will apply a color Doppler to help us understand the blood flow, if there's any narrowing of valves, leakage of valves, and whatnot. The next very common test that we perform is an exercise stress test, and this is done on a treadmill. A stress test is useful as it provides a lot of information. This is done with ECG information, blood pressure, assessing symptoms, and using a protocol on the treadmill. A stress test can help to detect any narrowing of the arteries. It can also help to detect other things such as a person's fitness and also blood pressure or any abnormal heart rhythm. Occasionally, we may also perform a stress echo. Stress echo is basically an investigation where we combine both the treatment, the importance of a healthy diet, regular exercise, adequate rest and good fluid intake. And it's also very important to avoid cigarette smoking, even secondhand smoking, vaping, and also excessive alcohol. And it's also very important to maintain a healthy body weight and to have ongoing health awareness to attend health talks. Okay, so how do we treat ischemic heart disease? As we all know, the importance of lifestyle modification. In addition to that, there's also medications and also the need for angioplasty and stenting. And in some patients, they may benefit from bypass surgery. Angioplasty can be broadly classified into emergency treatment for those with heart attack, and also an elective angioplasty for those who present with an abnormal stress test or abnormal CT scan. So I'd like to share what should we do if somebody has severe chest pain. The first advice is to go to the nearest clinic to get an ECG done, and the other suggestion would be to go to the nearest hospital who has a cardiologist and cath lab facilities. A cath lab is like a mini OT theater that has a procedure table and together with a machine, an X-ray machine that helps us see the vessels during the angiogram and also during angioplasty. I'd like now open the forum to any questions. Thank you.
Okay, thanks Dr. Nicholas for the informative and interesting talk just now. So we will go ahead and take some time for questions. So just a reminder, please be sure to type your questions into the comment box below the live video, and I will randomly pick up the questions for Dr. Nicholas to answer. So first of all, we will go through the questions that we gathered from Google Form. So the first question is, what is the earliest age that a person might get a heart attack? So perhaps Dr. Nicholas, you can share more on this with your experience.
Okay. So as we all know, heart attack commonly occurs in those between age 40 to 70, and in Malaysia, the mean age is a bit lower than our Western counterparts, somewhere around 56 to 59. The youngest patient I saw with heart attack was 21, and I believe some of my other colleagues have treated patients who had heart attack at the age of 16, and many a times patients who are very young with heart attack, they get it because of genetic factors such as high cholesterol.
Okay, yes. Yeah, so actually all the adults are advisable to do their medical checkup annually, and if you have any early symptoms as I mentioned by Dr. Nicholas, please go to any nearest clinic or you can come over to Assunta Hospital to consult Dr. Nicholas. Okay, the second question is it genetically linked for young people to have such attacks, and is there any else factor that cause heart attack?
Yes, we know for a fact that patients, people who have family members with heart disease, they are at higher risk of getting a heart attack, and this is due to multiple factors such as they can have higher risk of getting common risk factors like high blood pressure, high cholesterol, and also sometimes they may have genetic condition where the cholesterol may be very high.
Yeah, okay. Thank you, Dr. Nicholas. So I just want to add in some more. Actually, the dietary is also one of the contributing factors for the heart attack. So as a dietitian, I would like to encourage all to keep an eye on the total fat intakes, especially for those who like to eat outside food. Okay. So the next question is, what about concoctions such as apple cider, garlic, ginger, and honey? Heard it can dissolve these blockages.
Okay, so thank you for the question. So as most of us know in Malaysia, sometimes we hear that some individuals are taking this combination of apple cider together with honey, garlic, and ginger or whatnot, and they claim that these drinks can actually help to dissolve the blood clot or the cholesterol blockages in the heart. This is completely false. Till today, we do not have any medications or means that can dissolve or remove these blockages, and the only treatments would be medications to help to reduce the risk of a heart attack or stroke, and also an angioplasty to help to unblock these arteries, and those with multiple blockages may also benefit from bypass surgery.
Yes. So in conclusion, this kind of the herbals or any natural supplements are not recommended to consume because so far we don't have any clinical trial to date show it's effective to lower down the cholesterol. Okay, so now we will move on to the questions from the floor. So from the floor audience, the question is, how soon can I return to normal life after a stent insertion?
So thank you for the question. So it will depend on the setting of the angioplasty. For instance, if a patient had a full-blown heart attack, you would then advise rest for the first month, and your cardiologist will then perform certain tests like a treadmill test to assess your functional capacity, and also it's very common to have an echo scan to see how is the heart function, and then from there the doctor will then customize a program together with the help of a cardiac rehab team to bring you back to your baseline function. So if it's a heart attack, normally you need to rest for a while. Meanwhile, those who had an angioplasty stent insertion during elective setting, the rest usually is way shorter. For instance, a rest for a few days or even a week.
Okay. So in addition, I wish to ask Dr. Nicholas on behalf of my patient. So is it possible for the patients after doing the stent, they can do some light physical activity? Because most of the time, the patient after doing the stenting, they will also consult dietitians.
Yes.
And definitely, we will encourage them to do some light physical activity to keep them healthy.
Sure. So Tracy, very good question. So normally those who have elective stenting, we normally encourage them to do simple exercise like stretching at home or even some simple walks without any incline. So that'll be good. Like a 5-minute walk, 10-minute walk will be good enough.
Okay. Thank you, Dr. Nicholas, for the clear explanations. So I am getting also some new knowledge today to be applied in my dietetic counseling sessions. So we move on to the next questions. What to do if you are alone when you think that you have a heart attack?
This is a very good question. First of all, we do not encourage anybody to drive or to ride a motorcycle, as this is very harmful, very dangerous to yourself. The best advice would be to get help, call an ambulance, so that they can bring you to the nearest hospital to get further treatment.
Yeah, okay. Thank you, Dr. Nicholas, for the answer. So we will go to the last questions. Can I undergo MRI or any other imaging? Will it get affected?
So as we all know, the angioplasty is using a drug-coated metallic stent, and these stents are very thin. In fact, they can be as thin as 60 to 80 microns, and the MRI scan will not affect the stent.
Okay, thank you, Dr. Nicholas. So that will be the end of our Q&A session now. So is there anything else you would like to mention, Dr. Nicholas?
So as a final take-home message, I would like to first of all, thank everybody for attending today's talk. And the final take-home message would be, as we all know, health is a lifelong investment, and I'd like to wish everybody to stay healthy and safe. Thank you.
All right. So finally, we have come to the end of our talk today. So I would like to say thanks again to Dr. Nicholas for delivering such inspirational talk today, and definitely thanks all the audience for participating us in this Facebook Live talk. So hopefully the talk will be beneficial for everyone. For your information, we will have our second Facebook Live talk this coming Wednesday with the topic of gout, a disease of kings by our consultant rheumatologist, Dr. Shamala. So thank you for your attention, and we hope to see you all again on this coming Wednesday. See you. Bye-bye.
Thank you. Bye-bye.